Hey, Tara, I'm rolling on it in airspeed.
Alex, your mic.
Sorry about that, everybody.
All right, good afternoon, everybody. This is Ron Aiken. I am the Media Relations Director here at DHEC. Some of you I see on there I know, and some I haven't met yet, so I look forward to seeing you guys down the road. I appreciate you guys taking the time this afternoon for this call. I want to make it clear as we start that this media availability is for the purpose of supporting the release of DHEC's COVID-19 guidance for the 2021-22 school year, and allow anyone who has specific questions about that to ask them of our Public Health Director, Dr. Brandon Traxler. Questions about any other topics should be submitted through our normal media channels. And I'll ask that you please use the raise hand feature is the best way that I can call on you as I facilitate this discussion. And with that, I'll turn it over to Dr. Traxler.
Thanks, excuse me. Thanks, Ron, and good afternoon, everyone. And a big DHEC welcome to Ron, who's joined our team. We're very happy about that. Thank you all for making time this afternoon to hop on this call. I'll keep my remarks short so we can get right to your questions. As you know, last night or early this morning, we released our interim COVID-19 guidance for K-12 schools for the 2021-2022 school year. This guidance reflects the latest COVID-19 trends, and it is subject to change as new data and information and trends emerge. The goal throughout all of this is to protect our children and everyone who plays a role in educating them. This guidance represents our collaborative efforts with several entities, including the Department of Education and the Governor's Office. We thank them and everyone else who played a role in drafting this document. Lastly, as the guidance states, we strongly encourage all eligible students, parents, teachers, and school staff to get vaccinated as soon as possible. That is the best way to end this pandemic and to provide a safe space for our children to learn and our educators to teach. Thank you.
And I'll open it up to questions. Andrew James, go ahead, sir.
Yes, hey, Dr. Traxler. I wanted to start off with this question regarding the buses. And I want to say it was now included in the guidance that mask wearing is still required on the buses. Can you please go into that a little bit and how that's going to be possible with the State Department of Ed coming out earlier in the month saying they were not going to be enforcing mask wearing on buses?
Sure. So DHEC's guidance is that our recommendation is that they continue to follow the CDC's federal order that does require masks to be worn on school buses. I believe that was from January, maybe 29th. It was from late January of this year, that CDC federal order.
Libby Stanford, go ahead.
Hi, thank you for holding this. I'm with the Post and Courier. My question is there any room for districts to kind of move outside of the budget proviso that prohibits them from spending public funds on a mask requirement? And if not, what should districts do with the guidance from the CDC, knowing that they're not able to implement mask mandates?
So any alternatives regarding the proviso would have to be up to districts in consultation with their own legal counsel. But districts can strongly recommend, just as we're doing, that all those who are in K-12 schools wear masks while they're indoors.
Andrew, you got your hand up still. Andrew James. All right.
Sorry about that.
Hey, yeah, no problem. Go ahead, Dana. Dana Lynn, I think you're muted.
Hi, Dr. Traxler. Nice to see you on a Thursday.
I know, it's a little different this week.
Exactly. How much of a concern is it for DHEC that we could end up with a patchwork of recommendations from each individual 46 school districts plus in South Carolina?
So I think that the important thing is that while these plans may differ from the school districts, that they all be based on science and the guidance and recommendations that DHEC and CDC are putting out. We recognize that different local entities, different locations have unique features about them that may be different. We are not homogenous across the state, and so they have to put into place the guidance and guidelines that are best for their specific location. But we do strongly recommend some of the core guidance that is recommended in our in this guidance that's been released that we know is based on science and fact.
Anybody have anything else? Emily, go ahead.
Hi, Dr. Traxler. So in your layered prevention strategies, you guys have vaccinations and mask use as the top two things. These are two of the most controversial things in our state, with people just refusing to believe that they work and that they should be used. What do you guys have to say about that?
We know, based on the science and the data from numerous studies with literally at this point hundreds of millions of people vaccinated worldwide, that these are very safe and very effective vaccines. We know that they are the best way for us to bring this pandemic to an end, once and for all, which I know we all very desperately want. In addition, we have data, the more and more continues to emerge, just as it does for vaccinations, about the effectiveness of masks. Not only are masks safe for the vast majority of wearers, but they are effective. They are primarily to help protect others from you. But there's even data that has emerged throughout the course of this pandemic to suggest they help to protect you some as well. So we really do have robust data and science for these two things to show that they work and that is the best and most effective strategy to be finished with COVID-19 once and for all.
Marcus Navarro, go ahead, sir.
Hey, Dr. Traxler. It seems likely that there will be larger in-person class sizes and less students on virtual learning. Can you put into context just how important it is to comply with the guidance?
Certainly. So anytime you're going to have more and more people together, you're going to have a higher risk than, especially if those are unvaccinated people, that one of them may be infected or may not even be showing symptoms yet. They may be an asymptomatically infected person, but we know that the more people there are, then statistically there's more likely to be spread because classrooms physically have not grown in size in terms of their walls and their square footage. So that is why it is really important to do the best that schools can in terms of the distancing, looking at that 3 feet to the greatest extent possible. And then also especially the masks and the vaccinations, neither of which is dependent on square footage or walls, are constrained by walls. So we know those, again, are the two most effective strategies, and they can be done and are even more important with any size group of people.
Morgan Newell, go ahead.
Hey, Dr. Traxler, thanks for doing this. I was wondering if you guys are nervous at all about a potential increase of COVID cases in the state after students get back into school, and how you guys are preparing for that, if at all.
Sure. So it is concerning the number of cases that we are seeing increasing day after day right now in South Carolina, with school having not started back. So what I would say to that is, regardless of whether school is in session or not, we need the trend to be going the opposite direction. And anytime we're going to be doing activities, be it going to school or going to sporting events or concerts or whatnot, where there's increased risk, we really need to take those protective actions so that we don't see increases in cases as a result of them.
Dana, Lynn, did you have a follow-up?
Yeah, I actually have a couple. Dr. Traxler is used to this. The reality is, though, under the age of 12, there is no vaccine available. And I got to tell you, this morning, David Begnaud on CBS had a story that just, I'm not a parent. I don't have children. There was a 2-year-old, I want to say, in his piece, died. The whole thing about, oh, the younger kids aren't as susceptible. We're starting to learn that's not true with Delta, aren't we?
So we are seeing that Delta is spread more easily, certainly among all people. We are seeing more cases in younger individuals, which is partially due to the fact that, as you noted, under 12 are not even eligible for vaccination, and then the teenagers and young adults have lower rates of vaccination than our older population does. So we are seeing that shift in terms of the demographic downward. There is some emerging evidence to suggest that it might spread more easily or cause more symptoms among children and younger people, but there's still more evidence and data, I would say, needed on that to know for certain. But your story does highlight that it may be less common for children to have severe illness as a result of COVID-19, but it can still happen. And we're doing everything we can to protect each and every person, including each and every child in the state.
Emily, go ahead.
One more thing. I was just curious as to why you guys called it interim guidance. Is that just because it could be updated as the situation evolves?
Yes, and I think if you look back, I believe we did the same thing last year. It's interim because exactly it's the same reason we put the last sentence that's on there. Reminding people that we will be watching the data, the trends, not only in the state but specifically regarding schools. As well as the science and the information that's emerging, from the scientists who are doing studies, and that if necessary, we will change our recommendations and adapt those to meet the science and information that's available.
Andrew James, go ahead, sir.
Yes, just a quick follow-up, Dr. Traxler. Just your simple message to parents who are having to hear this from DHEC today, but all week have been hearing from other state officials that there won't be an enforcement of seeing masks in schools or even on school buses. Who should parents be listening to? Well, parents need to make the decision that they are the most comfortable with for their children, but recognizing that we do, as the public health experts, recommend that all individuals who are indoors in schools be wearing masks, so that we can have all of our children in the state educated and all of our educators be able to do it safely this year.
Marcus?
Hey, so right now the COVID vaccine isn't a student requirement. Could you walk through what it typically takes for a vaccine to become a school requirement like other vaccines, and I suppose how long that might take?
You're talking about a state requirement for schools?
Yeah.
Sure. So when we are looking at requirements for immunizations for school, childhood immunizations for school, we are looking for those that have that science and data to show that they are saving lives. Many childhood vaccines, if you look at the list of requirements, are on there. They are ones which have FDA approval, have gone through that rigorous screening and testing process. They have been recommended by the ACIP, the CDC's Advisory Committee on Immunization Practices, to be routinely given to children. And then they go through evaluation by multiple entities, both within DHEC and within our external partners that are involved in pediatric medicine and public health, as well as education in the state. And then eventually a decision is made to add a vaccine to that list of requirements. Those requirements are sent to parents and educators usually about a little over a year in advance of what will be required. Make sure that they have time to get their children up to date on vaccines, and then it goes into effect.
Well, let's give Brookley Cromer a chance. Go ahead, Brookley. Brookley Cromer.
Hey, hi, can you hear me? I'm sorry, I was muted. Hi, I have another follow-up question about the mask on school bus requirement, because according to SCDE, state law no longer allows the enforcement of masks on school buses, but the new requirement from DHEC says that masks are required. It's kind of contradictory, a little confusing. Can you kind of explain? What do parents need? What do they listen to?
Sure. So I think it's important to note that what we have put out is guidance. It is not a requirement. And so that will be determined by each school district in terms of they will need to evaluate the information provided by all entities and make decisions. But we stand by the CDC's federal order from late January and their guidance, which clearly states that they intend for that order to include school buses.
Emily, what you have?
Sorry, just keep thinking of things. So as far as school nurses, they're needed now more than ever. Obviously, this guidance has a lot to do with them. Is there anything that DHEC wants the school nurses to know going into the school year?
That we are right there in the fight with them against this virus, and that we really consider them a very valuable partner. And just as we, even pre-pandemic, had a very close relationship with many school nurses across the state, that has been emphasized even more and made even more important over the last year and a half. And we plan to continue that with bi-directional communication with them.
Dana, what do you have?
This might be the last one, but I make no promises. Ever since the CDC's new guidelines came out, new recommendation, it was like a thunderclap, and it's just been rolling across the country with mandates coming up. I think the latest, Facebook and Google demand that their employees get vaccinated before they come into the office, unless they have, a medical reason not to. Not just at schools, but in general, where does DHEC stand on mandating a vaccine?
So that is really something that each entity, be it a school, a business, a group, really needs to look at all of the circumstances surrounding that group and make the decision for themselves. But regardless of whether or not there's a mandate in place, we really very, very strongly encourage each and every person 12 years and older who are eligible to go and get vaccinated and get fully vaccinated. If you need that second dose, please go and get it. That's even more important than ever now with the Delta variant, to get that second dose if you got the if you didn't get the Janssen, if you got the Moderna or Pfizer vaccine. So we really encourage anyone, even if it's not a requirement, to please step up and roll up your sleeve and help play your part in this fight.
Brookley Cromer.
Oh, I'm sorry. Oh, I'm sorry. I didn't mean to do. I didn't mean to raise my hand again. I'm sorry.
Right. I don't see any other hands up at this moment. Last chance if anybody has anything. If not, I just want to thank Dr. Traxler for your time today and making some important availability out there for these folks so we can get this message out about these guidelines. And if anybody has any other questions, follow-ups, they can reply to the media page on the DHEC's website. And with that, I'll thank everyone for their time and for participating today. And I hope you guys have a great rest of the afternoon.
Bye, everyone. Stay safe.